Dear students, this is Ashok Kumar Shah from Admission Medical, and right now I'm standing inside building of University of Georgia. It's a medical science faculty building. So today, let me introduce you. I came to meet with Miss Anna, and she's gonna be explain us like how the education quality is in UZ and how the medical students gonna be have take participation and practical effects. So those all things let's heard by her own. So
Okay. Hello once again, students. We are welcoming you to come in the University of Georgia, and here in the university we have a lot of possibilities for foreign students, and we have a lot of laboratories which are for the clinical studies, for the clinical abilities, and so on. And I'm the head of the OSCE Examination Center, also the head of the clinical skills laboratories, and one of the laboratories which you are seeing here, and we are in the laboratory, which is called Mother and Child Care Laboratory. And in this laboratory, we have possibilities to learn seminars for the students. They can come and do the individual learning. So here they have possibilities to learn some skills, and also after they learn the skills, we have mentors, which are the student mentors. They come and together with the students, they demonstrate and learn from the start all of the manipulations they have learned before in the seminars.
Interesting.
Yeah. So here we have amount of students they can register on our sites, and we have students who are hired to work as mentors, and these students have high GPA, good students. We are choosing from the foreign students, of course, and they are teaching other students.
So
they are
how
helping.
do you rank the good GPA? Minimum should be good students.
We have the amount exactly. Good GPA means a lot of A's, A pluses, and B's, which means that with this kind of marks we have an amount of GPAs that are shown in the
minimum it should be
yes. Of course, we are assessing mostly. We are looking at clinical skills, which is clinical skills 1 and 2. When we see that they have high outcome in clinical skills 1 and 2, and they learn all the skills well, so they have possibilities to teach other students.
Right.
So, yes.
Okay. So, currently, how many numbers of medical students has been participated now?
We have started it. It's already 1 year that we have experience with the mentoring and with these laboratories that are actively in the process of individual work and seminar work. So every day we have possibility from 5 o'clock till 7 o'clock students to register and come, and minimum amount of students, that's 5 students. So if we can count every week, there's 5 days and minimum 5 students can register. So 25 students minimum a week we are receiving in only one laboratory. Except this laboratory, we have another laboratories too.
Can you explain what kinds of practicals materials available here, and what does it's begin to start the learning from here?
Yes, for example, because it's called Mother and Child Care, so here we have possibility to learn how the normal physiologic birth can be given. We have a new mannequin which has provides you us more possibilities. The skin, if you can touch and feel, it's near to the human skin.
Yes, it's human skin, very sensitive.
Yes, bendable, and the skin, the real when we have the child together with placenta and the umbilicals and everything, so it's inserted inside the stomach, which is already in imitation of the uterus. And as you can see, we have blood, we have urine, so different kind of clinical simulations can be done with the help this mannequin. And also she has a reflex of the eyes, which is when she gives birth she can move eyes and so on. So this mannequin, it provides us clinical case study, group work, how the gynecologists are working, how MENS are nursing process is done. So this is not for only medical students, it's combination work, group work, and it provides us how students can communicate with each other, how can they help the patients. And in critical process, besides the physiological birth, the pathological birth, for example, bleeding can be demonstrated.
Okay.
And it's way better for students to do fast helping process and to do manipulations better. Here we have infants, right? For example, we have newly born baby, right?
Yeah.
And here we have possibility to monitor the infants. For example, if we will switch this monitor here, it monitors the temperature of the baby, the pulsation, maybe some catheterization is necessary. So here, as you can see, we have blood flow.
Okay.
And first aid for infants, maybe the infant it's like early birth, so they can see how to help the infant and like this first process. Here also we have some pathogenic procedures, hernias and so on, and the cardiac monitor, which shows different type of, for example, if we have fibrillation, cardiac problems, and everything can be shown in the cardiac monitors.
Okay.
So if we are speaking about infants over here, the choking patient, also the nasogastric intubation and things like this can be taught here. After infant and babies, we are teaching them the child care, which are older children, 2 or 3 years old. Because we have experience when children are choking, for example, young children like infants and children at 2 and 3 age. And they need different type of help, right? So they should know how to help them. And one of the things that our mannequin is providing us has the same, for example, structure of the body, which, for example, 2 or 3 years baby are having. So they can do the choking patient first aid, for example, intubation, CPR manipulation, and it is the multiple functional mannequin that's also, as you can see, the how ambu can be fixated better and so on. Everything is manipulated. After learning, students come and do practice all the time these mannequins. Yes.
So thank you, Ani. It was wonderful information for so guys, students, you have heard about from Ani about lots of pediatric and about gynecologist education's information, and hope this all setups, whatever has been done is so nicely, so perfectly, and it's really a quality. It shows that you're going to be gain quality of education and knowledge for your future practice in doctor. So it's really helpful and really needful, because you can see they have very systematic, and she explained about that in a week. 5 students actually can be participants. So those all things are really I really appreciate these all things. So let me take you now for another laboratory and another skills of same explanation. Thank you very much.
Yes.